So let me move into the reauthorization of the Older Americans Act. Like many pieces of legislation, the Older Americans Act requires the law to be reauthorized every 5 years, with the last reauthorization being in 2006. So now that means now in 2011, the Older Americans Act is scheduled for reauthorization. In preparation for this reauthorization, our Assistant Secretary and the staff at the Administration on Aging held a series of listening sessions across the country to seek input. We heard from hundreds of people across the country on changes that they would like to see. And we also heard from people about things about the act that they liked. Some of them said, it's not broken. It's a good piece of legislation. Other agency organizations, area agencies on aging, and nonprofit organizations all held similar events throughout the country, and we asked for continuous input throughout the past year. I want to thank the National Hispanic Council on Aging and all of the other minority aging organizations for their recommendations. And we had a very good meeting not too long ago where they outlined what those recommendations should be. About a year ago, the Administration on Aging compiled many of these recommendations, and we have been reviewing them with all of the relevant agencies of the Health and Human Services Department. As I mentioned, and as you know, I come from state government and city government and was active in getting legislation passed at the state and local level. And I can tell you there's nothing like working here in Washington. But these recommendations also require the review of the Office of Management and Budget. So there's a lot of review of what these recommendations need to be. So needless to say, it has been a long process. But we are very close to having the final recommendations from the Office of Management and Budget. And at that time, our Assistant Secretary will meet with the many advocacy groups to discuss our next steps. So we will work on this together with you. I want to mention here also, as I mentioned, the recommendations from the National Hispanic Council on Aging, but I want to mention the work of the Diverse Elder Coalition. Dr. Cruz and other aging organizations who represent diverse populations, American Indians, Asian Pacific Islanders, the LGBT, and others, have met with Assistant Secretary Greenlee several times now. And I can tell you that they have put forward many recommendations to better serve our minority elders. Not only is it a diverse group in and of itself, the recommendations being made also focus on flexibility, access, and inclusion. In addition to these listening sessions, our Assistant Secretary has also made many presentations to Congress. She has testified in field hearings in Colorado, Vermont, Connecticut, Wisconsin, Minnesota, and on the Hill. And in these testimonies and in these hearings, what she is doing is educating and informing, telling the members of Congress about the Older Americans Act, what it does and what it brings and what its impact is on our community. I can tell you that historically, the Older Americans Act has always had wide bipartisan support. This bipartisan support has always focused on the goals of the act and, of course, on the outcomes. Well, as many of you know, the politics of Washington have been anything but normal lately. And much of the conversation and discourse on the Hill has been about budget, deficits, and of course, the economy. So as we decide on a path forward for the reauthorization of the act, we must take into account this political environment. We are watching, listening, and strategizing. And as we move forward on the reauthorization, we will do so in a transparent and inclusive way. The Diverse Elders Coalition are strong partners in this process, and we will continue to rely on them. Now, one final point I want to make today is to, again, iterate the fact that we are indeed paying attention. We are keenly aware of the aging of the population. We see the numbers growing each and every day. Our states are paying attention as they too know they must plan and strategize for the increased number of seniors in their communities. Now I want to say here for the record is that we at the administration aren't looking at these numbers as a bad thing. As a society, we are gaining in human capital and the interest in volunteering and engagement. So as we plan for the aging population, we are looking for new and innovative ways to support older workers as well as healthier, more educated, and involved volunteers. We also know that healthcare is a part of life, and as we age, our healthcare often changes. Our healthcare needs often change. That is why the Affordable Care Act, as we heard this morning, focuses on prevention, health promotion, and access to healthcare. And we are committed to healthy aging. We are committed to building partnerships and new collaborations to further support our values, our independence, and dignity. So as we move forward as an aging network, we must also look at our capacity and ability to provide services to an increasing number of seniors. So not only are we seeing, though, our population aging, we are also seeing a shift in the demographics of our entire population, with the Hispanic population leading this change. And our aging Hispanic population is also at the top of this change, as in 2009, Hispanics made up 7% of the older population. By 2050, this will be 19.8%. So we are definitely gaining in numbers. So we know that we must plan for service delivery to an aging population, but we must plan, and we heard this morning, we must plan for it in a culturally competent, linguistically appropriate way. In other words, we must look at a better understanding for one another and how we can communicate and really understand and hear people's needs and address those needs in our communities. At the Administration on Aging, we are committed to working with all of the aging organizations so that they not only understand and see and recognizing this change in demographics, but that we can work together as we prepare to address it. In closing, I want to again thank the National Hispanic Council on Aging for inviting me and allowing me to step in for our Assistant Secretary today. I remember my first opportunity to speak at your conference, and it was actually in my home state of New Mexico, in Albuquerque. I think it was about 4 years ago. And so each time I come here, it's a lot like coming home. So as community leaders, thinking about the aging population, I want to end by telling you that please know that there are resources available to help you plan, inform, and advocate on behalf of all seniors. You know, oftentimes when I talk to my dad and I tell him, you know, Dad, it's tough and things are kind of tough, and, you know, I start complaining and getting into my, you know, poor me kind of where I am, he looks at me and goes, well, you know, Cindy, I'm sorry, but nobody said it was going to be easy. And it's like, well, thanks, Dad. Nobody said it was going to be so hard either. But as we look forward and we know that these are not easy times, but we can work together in our communities. We heard the congressman this morning talk about advocacy and how we have a responsibility in our communities to educate and inform, to tell our decision makers who we are, what we need, and what we value. And so we have that responsibility. So coming to this summit, and the National Hispanic Council on Aging convening all of you leaders and community participants and people in this field, know that your voice is your strength, is our strength, and that's what we need to do. And as I watch my parents age gracefully, I might add, they told me to say that. No, they are aging gracefully. But I think about what my father has experienced in his life, from his New Mexico community of San Rafael, where he was born and raised without electricity or running water, to a time where the world is literally at his fingertips. We got him a laptop computer not too long ago, and you know, he's working on it, and he's getting it, but it's definitely a different time for him. And as I think about my mother, who has rheumatoid arthritis, has suffered a heart attack, and has multiple chronic conditions, she reaches the Medicare donut hole early in October because of the health needs that she has. But I think about them now in their golden years, and I think about their health. And I know that their health and their well-being is my responsibility. It is our responsibility. So again, I want to thank you all for what you do in your communities. Thank the Hispanic Council on Aging for what you all do, bringing people together, and for the work that you do in advocacy. Thank you.